Hello, folks. This is Dr. Hassan Galadari, dermatologist from Dubai, the United Arab Emirates, and I would like to welcome everybody to the hashtag #NSmart Pills of Science that's been put together by the good folks of Neauvia. Today's presentation is going to be a very quick one. It's what we call the pill, and what we're going to be doing is basically discussing the lower third of the face. So when it comes to the lower third of the face, there are a number of things, a number of aspects that we have to take into consideration. First of all, the lower part of the face is probably the most mobile part. You know, I'm using it right now for talking. You're using it, for example, for mastications or chewing of food. So it's probably the most mobile aspect of it. And it's very, very important because if you look at the face, there are many things in which you have to take into different aspect ratios. For example, the upper, the middle, and the lower thirds have to be put together in certain harmony, in which all the thirds should be pretty much equal to each other. When it comes to also the lower third is then divided by the lips into an upper and also a lower, in which the upper part of the lower third is usually about 1/3 the size of that of the lower 2/3. If that aspect ratio is slightly different, then the person might have either prognathism, meaning that, or micrognatism, meaning that the chin or the jawline is kind of slightly bent back, and that's the reason in which aspect you can actually use certain types of fillers or certain intervention modalities to bring this area into perfect harmony with the rest of the face. The aging process also affects the lower third of the face. It's probably the most important thing that affects that part of the face in all. As you can see, as a person gets a little bit older, the angle of the jawline tends to change. And that angle can go all the way up to about maybe 30 or 40 degrees in difference. Now, granted, of course, there are gender differences between the two different sexes, but however, the most important thing is that the aging process itself also tends to make that even worse. And this can also be seen, of course, by changes in the formation of the fat compartments that are occurring in the middle third that go down into the lower thirds, and we will see a little bit more about them. But the most important aspect of things is that you'll be able to see that the chin and also the angle tend to become a little bit more open or a little bit more obtuse. In addition, loss of dentition, which are the teeth, also tends to change the shape of the lower part of the skull. So it's very, very important for us to understand those changes so that interventions can be done to fix those areas appropriately. The most important aspect of anything that we do is going to be anatomy. And when it comes to anatomy of the lower third, it's very, very important. But at the same time, it's also very simple. Given the fact that there are a number of bony compartments in the lower third, we're able to tell where those major neurovascular vessels are going to be. So the most important one is going to be the facial artery in addition to the mental artery. The mental artery, of course, is going to come in from the lateral aspect, as you can see it here from the skulls, through the mental foramen. Given the fact there are soft tissues around it, the mental foramen may not usually be palpable, okay? But we do, however, know that it is not in the midline. It's pretty much on the lateral aspect, and usually it's very, very much equidistant from the same aspect as the infraorbital foramen, which also is related to that of the mid-pupillary line. The other one that we are able to kind of palpate is the facial artery. And as you can see over here, these are the two major vessels. So the facial artery lies very deep on actual bone and is just in front of the masseter. So what you tend to do is that you ask the patient to clench their teeth. You're able to clench their teeth, and just in front of that area, you're able to feel the pulsation of the facial artery. The facial artery is the most important vessel of the lower third in addition to the mental artery. The facial artery can easily be palpated and can be avoided by knowing exactly where to inject and what plane to be injected. The mental artery is also very easy to avoid by knowing exactly not to inject the lateral aspect of it and also not to inject too deep. As you can see here, this is the mental foramen. The mental foramen lies pretty much deep underneath all the different structures, especially that of the muscular structures and also the fat compartments. And as you can see here, it is on the lateral aspect of matters. It is not in the midline. So if you are injecting the midline, usually that's a safe area for you to inject. As with regard to the fat compartments, if you look at the fat compartments of the lower third, they're mainly continuation of the fat compartments of the middle third. So what happens to them is that those compartments tend to kind of go downwards, and you know they're the ones that tend to kind of basically be able to be visualized by in the formation of the jowls. So in front of for example, the jowls, you have the prejowl sulcus, and this is usually caused to the effect of the mandibular ligament that's found in that area. One of the most important things that you have to understand, especially by looking at this slide, is that the platysma lies underneath the fat compartments. And the movement of the platysma is that it is able to kind of pull the fat compartments from the middle third and the lower third downwards towards the neck. It's very important for us to understand that, because here blockage of the platysma using neuromodulators, you're able to provide a little bit of a lift of the fat compartments. It is also equally important for you to understand that if you are going to be accentuating the jawline, is not to inject areas that are already accentuated by the fat compartments coming from the middle third. If you are placing fillers, for example, in your jowls, you're basically making the jowls more. That's the reason why fillers have to be placed exactly in the right area along the bone line, okay, to be able to kind of see and provide high definition into the aspect of things. Muscles of facial expression, of course, are also directly attached to the skin. If you're going to a little bit more on the superficial aspect, and you can see here is that what happens in the nasolabial and the labiomandibular sulcus is that there is a change between the type 1 and type 2 subcutaneous arrangements. The arrangement of the muscle fibers tend to kind of change into that area. Okay. The most important thing, if you look at the musculature of the lower third, is the actual way that they're basically put together. It is extremely important for you to understand where it is that you want to place your fillers. If fillers are placed a little more superficial, what can happen to them is that the effect of the muscles in that area can make and contort the fillers accordingly. That's the reason why you have to be very careful to know exactly where to place and to exactly know what filler that you want to place into that area. For example, if you are placing a filler into the chin, you want to make sure that your filler is very thick, that has basically of a high G prime, and it should be placed underneath the mentalis. If you place it over the mentalis, the movement of the mentalis is going to make your filler visible for the patient. That's the reason why you want to place it underneath the musculature. However, if you are going to go on the lateral aspect and placing fillers in the lower third just underneath the perioral areas, you want to make sure that your fillers are actually softer, so that of a low G prime, and at the same time they should be placed a little bit more superficial, because if you place them deep, that's where your mental foramen is going to be with your mental vessels. Of course, there are differences between men and women skulls, and if you look at the lower third, because that's a major aspect that we're dealing with, is that there are two things that are different: the chin and the jawline. The chin in a male is more square, and usually it is separated between the two oral commissures. So the different oral commissures provides a little bit of a squarish effect, while in a female chin, it's slightly more rounded. And the line of demarcation is going to be between a superficial line, basically, that looks at between the ala of the nose. With regard to the angle of the angle of the jawline is slightly more right in a male patient, so it's about 100 to 110. And in a female patient, it can go up to 115 to 125. Okay, so you want to keep that in consideration whenever it is that you're going to be injecting that area. It is very easy to masculinize a female patient. You want to be very careful. It's not common to do that with a male in the lower third, but it is very common to do that in a female patient when it comes to injecting that area. So you have to be extremely careful when it comes to doing so, to place the filler not just in the correct anatomical landmark and plane, but also to kind of accentuate what is supposed to happen in that area to provide that norm for that gender, okay? Whether it's a male or whether it's a female. So where are the locations for the lower third of the fillers, and what type of fillers you would want to use? If the location is going to be in the marionette lines, because that's basically the lower third, or basically in the nasolabial folds, the danger zone is going to be the angular artery. Okay, the depth of injection has to be deep in the upper 1/3, basically, which is basically the perforam fossa. That's where it's going to be placed. However, it has to be superficial when it comes to the lower aspect of it, where the modulus is. The reason for this is that because that part, basically, the vessels are quite deep. When it comes to the chin, remember, the chin has to be, your filler has to be that of a thick, high G prime, has to be placed deep right in the center, underneath the mentalis. If you want to place it more superficial, especially on the lateral aspect of things, very close to the marionettes, at that point you would use something that has a mid G prime, and at the same time something that's a little bit more on the softer side, okay? Because the danger zone here is going to be where the mental foramen is going to be. The jawline, finally, is going to be it's going to be placed The depth of injection is going to be deep. Remember, the facial artery is in front of the masseter and is deep, but you're going to be placing your filler right in the jawline, which is basically a little bit further back. So there are no major effects that happens over there. And it can be placed also superficially in front of the masseter. Okay, but that's the case. But if you are placing it in front of the masseter, it has to be superficial placement. And in both cases, the filler remains the same. It has to be that of a high G prime, because what you're trying to do is that you're trying to emulate that of effects of bone to provide high definition. What type of filler would you want to use? Given the fact that all the different Neauvia portfolio that you have, my preferred filler in that area, in the lower third, to enhance basically my jawline and also enhance the angle of the jaw and also the chin, I would prefer using Neauvia Intense. The placement of Neauvia Intense is supposed to be in the supraperiosteum, so it is quite deep, okay, and it's basically designed to provide the highest concentration of HA in that area and also the highest G prime. Once it is placed, it has a very long-lasting effect, and from all the different Neauvia portfolio, it is the firmest product, and you'll definitely feel it whenever it is that you're going to be injecting. You would require the use of a 22 gauge cannula because that product is quite firm when you're going to be pushing it out. So that's basically what you need to do. Okay, and it has the highest lifting capacity from all the different HA fillers in that portfolio. And now we're going to show how it's going to be placed. All right, so what we're going to be doing, as you can see here, this is a female patient. And when it comes to placing our fillers, the most important thing is to figure out exactly the landmarks. And for me, I would draw a point right where the the angle of the jaw line is. And that's basically the area of my entry where it's going to be placed. And if you look at the angle in a female patient, it's slightly different than that of a male. Here, it is a little bit more on the more open and more obtuse. So it's a little bit about 100. In her case, you can see here, it's about 110 to 115. And right in front of that angle, that's basically where the masseter muscles are going to be placed. So if when it comes to placing your fillers, you want to make sure that you do not place too much of fillers into the masseter components, because what can happen is that that can provide a widening of the face and then a little bit more on the masculine side. I asked the patient to clench her teeth, and while clenching her teeth, I'm able to feel the pulsation of the facial artery. And upon feeling the pulsation of the facial artery, I know exactly the area in which I would want to try to avoid completely. And as you can see here, the facial artery then continues upwards, divides into two different vessels, an inferior and a superior labial arteries in that aspect of things. And this is a very simple, very appropriate approach into that area. When it comes to injecting that point, you have to be extremely careful on what level of plane that you're going to be. You are able to be deep into that angle, okay, and also across the line. So basically, so you can see all these two lines, you can definitely be deep there, and you have to be using a cannula. It's much safer to use a cannula. You can use a needle if you're going to be just accentuating the actual angle. But if you want to place it along the ramus, whether it's the inferior or the superior, you would want to place your fillers more or less on the deeper side. And the closer we go just in front of the masseter, very close to the facial artery, the plane of injection has to change. And once we reach that area, it's important for us to realize that we have to be a little bit more on the superficial aspect, because the bone is where it's because the bone is exactly inferior where the facial artery is going to be. So you create that little opening, and the opening is just to the point that we kind of showed you in the just in that little diagram prior, and you go straight in. And I'm using a 22 gauge cannula. I go straight in into that angle, and then you can see here I'm running very much parallel to that of the jawline. It's extremely important for us to realize how that's going to be placed in. And you can see here the cannula itself is going to go right across and runs parallel. Your non-dominant hand is extremely important because it tells exactly what level you're in, and at the same time where the tip of that cannula is. Remember, you want to make sure that you are not very close to the facial artery, even though you're not on the same plane, but you just never know. Sometimes it can be flipping, okay? And you want to place in your fillers into that area. And you want to make sure that also the filler runs across the jawline. You don't want to place it too superior or too inferior. A little bit more on the inferior side will make the face a little bit more longer, more boggier. A little bit more superior will make the face a little bit more on the wider side, and that makes it a little bit more on the masculine. So after we're done with the inferior aspect of the jawline, you want to recreate that area of the ramus. So and that basically, once you do that, you just turn around. It's exactly the same injection point, and you place in your filler. And as you can see here, the non-dominant hand is very, very important. It is key to know exactly where the tip of the cannula is and basically it runs along to kind of feel how much volume is injected at that aspect. You can see here how the angle of the jawline is very much being accentuated as compared to the other side, given the fact of this technique. Remember, you want to inject very slowly, and you want to also inject using a 22 gauge cannula. That's the best thing for you to do. And it just basically defines the whole thing. The filler that you are using here has to be that of a high G prime, and that's the reason why I'm using the Neauvia Intense. The Neauvia Intense aspect really provides me that really strong definition when it comes to doing it in the jawline. And if you're going to be placing it, I'm going to lift her up just so you're able to kind of look at the differences between the two sides, and you're able to see that the right side has become much highly defined as compared to the left side. And it's a very subtle, yet an extremely natural, but it's a great results given the fact that what you're able to see. All right, now the other aspect of dealing with the lower third is going to be dealing with the chin. The chin is extremely important because you have the mental artery that's there. The mental artery, unlike the facial artery, you are unable to tell exactly where it's supposed to be, but you are able to kind of visualize where it's going to be based on the mid-pupillary line. So you want to try to avoid injecting on the lateral aspect of things. If you are going to be injecting the lower third, there are differences between a male and a female. A male, as you can see here, what I'm drawing right now, is going to be from the oral commissures. So the filler has to be placed between the oral commissures to provide that squarish effect. However, a female, you want to look at the nasal ala. So it's going to be from the ala of the nose. Basically, you draw a line over there, and you can see here the differences between that of a male. It's about a good 1 to 1.5 centimeter of difference, and that's extremely important. That little small amount of space really makes a huge difference between a squarish type of chin and a roundish type of chin. And in this case over here with this patient, because she's a female patient and she wants to accentuate that femininity, you want to place your fillers right into the center, right under that circle, where that round circle, in between the lines that were drawn by the ala of the nose. There are two major components. If you want to lengthen the face, basically your injection point has to be placed a little bit more inferior. If you want to, that's basically for elongating or making the face more or less oval or more vertical. If you want to kind of provide a little protrusion of the face, then the actual filler is placed right in the menton, and it's just basically placed a little bit more superior underneath the mentalis muscle. So these are the two different components on where they're going to be placed in. In her case here, we do not want to make her face longer, but we do want to recreate a little bit more of a shape that's placed into the center and to provide a little bit more of a protrusion effect. So you go straight in, and here I'm using a needle. You can use a needle. I'm using a 25 gauge needle for my filler, and you place it right in the center. Look at my non-dominant hand. It's holding the chin very much intact, and it's placing the filler right there into the center. It's extremely important for you to do so. You can do exactly the same thing with the cannula, but I'm basically kind of showing how a needle can also do the exact same thing. If you're going to be using a needle, it has to be a 25 gauge needle for the Neauvia Intense. If you are going to be using a cannula, you have to go back into that of a 22 gauge. The 22 gauge provides a little bit larger bore so that the filler is able to pass without having any issues in that area. You place in your bolus right in the center, and then you have to round the area around it, because if you only create a bolus in the middle, what happens to it is that you're creating a little bit of a mountain, and it's not going to look natural. You have to soften up the edges, and by doing so, you place a little bit filler just a little bit more onto the sides. So this is basically what the components in which you want to do. We're also going to be enhancing just a little bit of a vertical support, and exactly the same point, a little bit more on the deeper side. This will provide a slightly more vertical support for the chin, and then will also make the face slightly more oval as compared to that of a roundish type of face. So exactly the same thing. However, the filler here is placed along the jawline in the chin. Okay, so it's a little bit more on the inferior side, and it's also touching the bone, and it's going to be quite deep when it comes to its placement. Now, the final effect, of course, how lateral can you go when it comes to a female patient? The lateral aspect of things when it comes to a female patient is the following. You can come to the lateral aspect only if the patient has marionette lines that is caused usually by the mandibular ligament. If the patient does not have these prejowal sulcus, then basically you do not have to inject her. But you will only be able to do so if she has those pre-Java sulcus. I would highly recommend not to do that in any other types of patients, especially females, because if you do so, what can happen is that you're squaring off their chin and you're also masculinizing them. And with this, ladies and gentlemen, ends the lower third pill. And I would like to thank all of you for tuning in and for listening to the hashtag #EndSmartPillsOfScience. Pills of Science. And I look forward to welcoming you again in future renditions. Thank you.